Afternoon. This is the House Appropriations Committee. It is Tuesday, April 29th, 2025. It's 2:00 in the afternoon, and we're continuing our journey through federal funding in agencies and departments across state government. And this afternoon, we're delighted to have with us the folks from the talking about the Child Development Block Grant from DCF, Department of Children and Families, Child Development Division. We have Janet McLaughlin, the Deputy Commissioner, and Megan Smeaton, who's back for another encore performance. We could set up a little something for you then. So welcome once again. And if you'll introduce yourselves, we have some documentation on our committee page, and then we'll take a look and go from there. Thanks.
Hi, good afternoon. Janet McLaughlin, Deputy Commissioner in the Department for Children and Families that oversees the Child Development Division, which is sort of all things childcare and children's integrated services. And we also co-administer Universal Pre-Kindergarten with the Agency of Education.
Which part is it? Pre-K? What is it?
Universal Pre-Kindergarten. We co-administer
Universal Pre-Kindergarten. Yes. Sorry.
And Megan Smeaton, Financial Director for DCF.
Thank you.
And so definitely with Megan's help, we have prepared a summary of the CDD federal CDD budget, federal funding sources overall. So not just the child care development block grant, but the CDD budget overall. So if we're starting with, I don't know what order things are for you guys. You guys have it looks like this.
That is page 3.
Okay.
It's like that. 2 charts.
Oh, yes. Okay.
Okay.
So just in terms of the big picture, yes, I think maybe it's helpful to look at the big picture before getting to the details. So the chart that's state fiscal year 26 CDD gov recommended budget by fund source, right? So you can see, GF as the general fund, SF is the special fund, right? That amount used to be much, much smaller before Act 76, right? This is now where all of the funds raised through the payroll tax for the child care contribution tax.
So are those the numbers without commas? So those are the amounts?
Unfortunately, the commas did not transfer over.
So
42 million, 43 million, that federal funds?
115 million in special funds?
Yes.
And the 115 million is not just payroll tax.
It's payroll tax plus a transfer related to
the earned income tax credit, which we swap with the tax department. We send over TANF federal dollars, and they send back a special fund that is state funded.
So that's how TANF gets into here.
To some extent, yes. There are other ways that TANF gets into CCDF as well, but I would say that, in fact, TANF is actually hitting the tax department's budget, and we're using the state funds that come back.
Okay. And so of the 115 million, I don't know what date this is as of, but do we know how much is from the payroll tax at this point?
I can tell you that. So it was 18.5 million, I believe, that is combined the other special funds altogether. So there's 15 million from the EITC swap, and then a little bit more from several other special funds.
15 for the
1.5, and then everything else that's in there is the childcare contribution.
So you're
just
saying
under 100.
100 million
Mhm.
is in the child care payroll tax? No, that can't be right, because they didn't have that much when we last talked to them. I was thinking it was around.
So this is the state fiscal year 26 governor's recommended budget projection, right?
Not actual, never
Yes.
mind. Okay.
18.25 was, which is,
Yeah, so
Okay. Okay, and they really don't compare, do they, the 24 and the 26, because the payroll tax just went into effect last July for FY 25, so.
yes.
Yes. Year to compare with.
Right, and so there's jump and there's a special fund, and then you can see that almost 43 million, right, projected in federal funds for state fiscal year 26.
Right.
And then the global commitment, GC, right, is the global commitment money, and that's the 15 million as well. Of which, would we consider any of that federal fund, or is that?
Global commitment, it would be federal funds at the FNAP rate, which is on the chart, so it's 57.5%. Federally funded in 25 and 58.8% federally funded in 26.
Right, so that's a mix of federal and state funds, the GC amount there. Right, okay, just, right, so we're looking at about a quarter of the Child Development Division's budget, right, that is federal funding.
Okay, about 25%.
Yes.
And then down below your fiscal year 24, what is CCDF?
So the Child Care Development Fund, so the federal grant is the Child Care Development Block Grant. But then, like, that's what the federal legislation is called, but then when we work with our Office of Child Care, they refer to it as Child Care Development Fund, and so that is what we typically refer to it as.
Okay.
But those are the same sources, right? So when we, look at the state fiscal year 24 federal funding sources, and again, because we looked at that, we did decide to look at actuals and for that, and so CCDF there is the biggest part of the federal funding that we get.
Right.
But we just didn't want to we wanted to make sure that there was the information that there is a variety of federal funding sources, right, that are contributing to the work of the Child Development Division, both childcare related and children integrated services related.
And Head Start is part of your federal funds, but it's only 115,000.
So Head Start is a federal to local grant program. The money doesn't come directly through, come through the state. So we get a small grant from the Office of Head Start to run a Head Start collaboration office, which in a state the size of Vermont is one person and has with a small project budget.
Do you know how much goes out to the local?
Yeah, the local Head Start grantees receive about $27 million.
27 million.
Yeah.
And I've been reading a lot of not so good things about, what's may happen with Head Start. That's one of the ones that
It's very, no, it's, yes, that's one that's very,
it feels precarious at the moment.
yeah. It is. I mean, it's been both things. You've seen some communications where they've said, early on anyway, they were sort of saying, of course, we don't mean Head Start, but that's not what that's not what they said last week. So.
Right?
So this amounts to the entire budget for pre-K and kindergarten?
No, this doesn't include the pre-kindergarten money mostly runs through the school districts. It's part of the education fund, right? Because it's publicly funded.
So what does this money get applied to kindergarten?
So I'm happy to, so if we look at let's see, the two charts.
The one with all the words on it or the one with all the numbers on it?
Just tell me how you guys want to think about it. Right, so the one with all the numbers on it, right, has the funding source, and then it looks at, it's just giving you an idea of what is salaries, what are some of the internal operating expenses, and then you can see, this is just, this one, sorry. I'm really sorry, you guys, it does not have a heading on it that is as helpful as it should be. Because that's just the federal fund, those are just federal funding sources only. And then you can see childcare financial assistance and the childcare financial assistance program and children integrated services. So when we're thinking about salaries and operating, like that does include like all of our childcare licensing staff, right? We've got a big team of folks that are going out and making sure that childcare programs are safe and following the rules and investigating complaints.
So I'm not sure where you are at this point. Are you on the chart? If we look at.
Yes, if you're looking at the chart.
So if we look
Yes.
at that.
Yep.
So idea part C. Let's just.
Okay, we'll start there. Okay, that sounds great. And so for IDEA Part C, right, that is the Individuals with Disabilities Education Act. So Part C is the funds mandates, is for early intervention, right? So this is for young children, infants and toddlers with disabilities. And so that we are mandated to serve by federal law, but also I believe by state law as well. And so that is what that money is for that.
So you get 2.549 million in federal funds for that.
Correct.
Okay.
Yep. Then the other federal funding stream that flows into children's renegade services is global commitment, right? And so, and children integrated services for folks, right? It includes 4 main services. It's early intervention, it's family support, home visiting, it is early childhood mental health. It includes some specialized childcare because some kids need some extra supports to be able to be safely included in care based on their family or their developmental needs. And it includes service coordination for all of that, right? So that there's a single point of contact and that families aren't having to deal with multiple case managers and multiple insurers and all of that. So global commitment, this shows just the federal portion of it, right? But global commitment is the other major funding stream for children's integrated services. And then the next line, right, is just a small amount for CHIP. For those children who are CHIP eligible, instead of being billed to Medicaid, they'd be billed to CHIP. And then Medicaid administration, right, because there's a lot of billing associated with CIS, right? We have to have some staff that are working on the funds to actually draw down those funds and work with our partners that implement integrated services. So that's I tried to sort of group them in that way. So that is really the Children's Integrated Services Program, right? Which is, right, obviously critically important for those really young children and really heavily reliant on federal funding.
What's PDG?
So PDG is the Preschool Development Grant Birth to 5. So this is a grant that the Child Development Division holds, but it's a multi-agency grant. And if we're doing that, some of this detail is on the one with all the words.
Okay.
So that's helpful. So it's really a grant for early childhood systems and quality improvement projects. And it includes multiple agencies. So CDD holds it, and we have some projects within it, but there's also funds that run to family and child health and BDH through Department of Mental Health, through Agency of Education, through the Office of Racial Equity, and through Building Bright Futures. So it is a multi-agency project, and the current grant ends on December 30th of this year. There was supposed to have been an RFP out for the future at the end of February. It is still no RFP. So that is, it's been a really important source of funding for sort of quality and inclusion work, and for some of the data and the systems projects. That's the kind of work that's funded with that.
So these are pass-through grants to these other entities?
Yeah, so I mean, the other state agencies, right, or state department or departments within EHS, right, we have an MOU, but yeah, we all kind of come together to put together a proposal all together. The only entity that's outside of state government within that project is Building Bright Futures, right, which has its own sort of special legislative status.
So you get together and come up with ideas to have a quote unquote program of some sort? that
Yes.
you agree on?
Yes, multiple. So there's been a lot of there's projects around like data integration, right? So that we can actually be able to, track children and understand what our investments are. There's projects, what the impact of the investments are. There's projects around building skills related to including children that have additional needs within different early childhood settings.
Metrics for success, failure?
So this is one that's a little tricky because it is systems building, and that's one of the systems being built is what are these metrics? Right now, it really is like, did you deliver on the things that you said you were going to do? It's more, but there is an evaluator built into the project as well. So that is, so that was PDG Birth to 5. The community-based child abuse prevention grants, again, so relatively, it's an important but small amount of money. And right now, the way those funds are used is they're distributed to the Parent-Child Center Network, and then out to the parent-child centers, and they're using that to support concrete needs for families. Again, with the theory that if you can buy that set of snow tires for a family so they continue working, families less stressed, and that reduces the chance for child abuse or neglect.
You just reminded me when you talk about the parent-child centers.
Yes.
It seems to me when I visited with them, that a lot of what they do is similar in some respects to what Head Start attempts to do. And I'm wondering if, and I don't want to be a pessimist, but if Head Start for that program is reduced or eliminated, does that put additional strain on the parent child centers?
Yeah, I think, yes, absolutely. I think if Head Start were eliminated, it would put a lot of strain on child financial assistance. It would put some additional strain on children's integrated services, and on the parent-child centers probably would be the most needed to fill in the wraparound
Head
services.
Start programs are, I know we have one in Rutland, but we have a parent-child center.
Right. Yeah. So Head Start is designed to both provide like an early learning experience, but it's also really designed to wrap around with family supports and health screenings and all sorts of additional services. So yes, there would be a hole for those families, and it is designed to serve families that are, below the poverty level. Maybe I think you can have a certain percentage that are between 100 and 135% of the poverty level. So really the families that are in Head Start are some of the neediest in our state.
Just share what I was going to. Basically, Head Start's a very narrow cohort demographic that they serve. But it can,
But some of
if that goes away,
some of the same programs that we are trying to wrap in the family, right?
similar, yeah.
It's similar, but it's a narrow cohort, and it's really these really strong, deep it's narrower group of people, but it's a very deep relationship with those families. Yeah.
Which is helpful to know. I just know where we come
No, that's right. No, these are the kinds of things that we're thinking about too, of where that, of how that would work. And then, yeah, in some places, like in the Northeast Kingdom, the Head Start agency is also the parent-child center. So it's different in each community. Okay. If you want, should I keep going?
Yes,
Okay.
CCDF.
Yes, because we were talking about Head Start Collaboration Office. So CCDF. So right, this is the large federal award related to childcare, and it is funding a portion of our childcare licensing staff. Things I was mentioning, and as well as childcare subsidy. Right. So CCFAP, and then we also are required to and are happy to use some of the money for childcare for quality and workforce development programs for childcare as well. So of that grant that we get in, we have to use 70% of it for direct services. So that really is for paying for childcare subsidy. But we also, at this moment, and based on the grant as a structure right now, we also are required to use like 12% of it for quality efforts. And so we use those things to fund professional development, scholarships, and other supports for the workforce, typically.
Can I just ask a quick,
Yeah.
clarifying question? So is that, the money that is for professional development, et cetera, is that for a particular kind of slice? Is it certain kinds of childcare? Is it limited to those childcare workers or centers that actually serve the most vulnerable kids? I just don't know what the.
Yeah. No, it is
Throughout the system.
It's throughout the system. Yeah, it's really designed to it's really designed and it's intended to serve children that are within all kinds of licensed regulated childcare programs and at all stages within the workforce development continuum, whether or not it's that person that's just starting out, or maybe it's somebody who wants to, who's, feeling ready to become a program director, or, wants to, even somebody who, maybe is working a community-based program, but is wanting to pursue teacher licensure.
Okay,
Yeah, I was just gonna say that a few years ago, we talked about partnering with the Department of Education, Agency of Education now for the early childhood. There's this kind of thing, one of the things that created in that partnership was, at the same time, it created a huge educational component that a lot of childcare people did not have.
Mhm.
Do you use this money for educational purposes?
Oh,
To
yeah.
help people with their tuition or whatever?
Absolutely. Yep. It funds scholarships. It's funding student loan repayment. It's funding tuition grants, for some, that person maybe just has a couple extra courses that they need to achieve their next credential, or maybe they have a degree already and it's in a different topic, right? So they don't need a whole nother degree. They just need a few additional courses to make sure to have them, achieve the credentials that are needed to be a lead teacher.
Tiff just brought something up. There's a lot of programs. 504 is an example of one. There's no income eligibility. If you qualify based on your disability or your circumstances, you participate in the program. You're eligible to be in the program. Preschool, a lot of times they did that with AAA and compensatory education. Is that something that builds in with these programs as well?
So so this is really tied for universal pre-kindergarten, right? That is publicly funded education. And for 3 and 4-year-olds, they have the right to early childhood special education services. That could be tied to their pre-K enrollment, or it could also be separate because that child may or may not decide to be enrolled in pre-kindergarten, or it may be that the school district isn't able to offer their special education services on site where the family is enrolled in pre-K, and instead they go to a school district. So it's a complicated picture because young children are mandated to receive early childhood special education services, but they're not necessarily mandated to attend school in the same way that older children are. So it's a slightly more complicated picture there, but that's the entitlement. There's no entitlement to childcare officially,
Yeah.
right? There's just an
Yeah, I understand the
entitlement.
difference.
Yes.
Yeah, I understand the difference. I'm just saying that when you talk about these programs,
Mhm.
is it an income-based eligibility only?
Oh, well, so
They've got
for some of the
needs.
workforce, so if it's like a work, right?
Whatever.
No, for our programs, so we have a partnership with with Community College of Vermont, and they offer a ton of training and support for people who are working within regulated childcare programs, whether or not that's a family childcare program or a center-based program, or even an after-school program that's regulated through the state. And anybody who works within those programs can access those services. And as long as we have over 1,000 regulated programs in those different categories across the state. And we're not saying, we're not looking at what's the makeup of the families that any particular program serves to decide whether or not, what professional development is necessarily available to them. There might be a few things, like if it's like we've only got 10 spots for this training program and a program's applying, right? That might be one of the criteria that we're giving, but we aim to make sure that anybody who wants to work in early childhood education, right, is supported to do that.
Awesome.
Yeah.
Okay, thank you.
I will add that the CCDF in general does have eligibility requirements. So the
That's
funding that we spend on actual supporting of childcare slots in our CCPAP program, the CCDF we use, that is tied to eligibility of the household.
Just wanted to double check.
Even if the
Yeah.
overall professional development is not tied to that.
Right, so the children.
Yeah.
Okay, sorry.
Yeah.
Okay. So yes, no, she's right, that the in terms of the CCDF funding, right, is specifically for children, for the direct services is for children that are below the 85% of the state median income, and our childcare financial assistance guidelines now go above that. So those children are paid for with state dollars only.
Okay, thank you.
Don, you have a question?
So individuals pursuing licensure or workforce development here to higher levels of working in childcare, is that a reimbursed thing back to individuals, or is that, you know what I'm saying?
Yeah, it depends on.
Courses being offered and people have to meet eligibility and sign for it and enroll.
Yeah, we kind of have all those
You
options.
have all those options?
Yeah, so we have a way where you could apply for kind of a grant that, if you need to register for a specific course, that would, you show us that you registered, you can get the money. We also have a scholarship program that you would enroll in and actually that money UIC runs that would, that pays directly on behalf of the student. And then we do also have supports for people as they achieve certain levels of credential, that they're receiving a financial incentive recognizing the investment that they made.
Thank you.
Dave and Wayne?
Going to paint a picture
Okay.
and see where, if at all, we help families. So the childcare is going to a great, we still have stars, 5-star childcare program. And during the day, everything's great. At the end of the day, she goes home and the cupboards are bare. The toxic stress in the household is just hitting the top of the scales. Mom and dad sadly communicate more with their hands than they do with words. The dad is being hollered at work because his old car didn't make it in the other day. It's just not a healthy situation. Any of these funds here, these charts aimed to help families in that kind of situation?
Let's see.
Or does that fall into a different department?
Well, some of it certainly falls into a different department depending on, how that's actually ended up being expressed for those children. But so children's integrated services, right? So that's for mostly for those younger children, right? But that does include, right, family support, home visiting, right? That is including early childhood mental health, which is really support for both the child and for the parent typically. So some of that's happening through that children's integrated services program. Within childcare programs, and especially if you're talking about sort of a 5-star program, we do have, one of the elements of that is strengthening, is a model called Strengthening Families.
Do we still have strengthening families?
We do.
Okay.
Yeah, it's part of the STARS model, and it's even more strongly into the STARS model than it was before with the latest revision. And we do have some Strengthening Families grants as well.
Great. And I'm almost done. Sorry.
You're good.
Yeah, I wouldn't expect you to know off the top of your head, but when you think about the array of childcare programs we have, any idea what % are 4 and 5-star?
I literally looked at this yesterday. But I was looking at it because we have a new design on our dashboard. So it's very easy for me to find, and I will.
Is it a big number, do you
Yes.
think?
4 and 5%? Yeah.
4 and 5-star.
First, yeah, sorry, at 4 and 5 stars. Yeah, it's a bigger number. We have recently transitioned to a new star system that people are still kind of getting used to right now. But we've also really invested in some quality coaching for programs in a new way.
That comes extra reimbursement for the provider.
Kind of. It doesn't, so one of the things that happened in Act 76 is that we eliminated tiered reimbursement associated with stars for childcare financial assistance subsidy. But because the goal, right, is to make sure that every program has the resources to serve all children well. But there was also a quality and capacity incentive program that was established in Act 76, and we've started that process. And so that does include higher stars bonuses for those programs that achieve the higher levels of stars, or it includes support for individual educators as they're increasing their credentials. And it includes, and it will include a sort of an annual payment for programs that are consistently performing at the higher levels of stars.
We used to have a program called Success by 6, maybe before your time.
It was. So I've heard about it for many years.
So,
Is it?
Success after 6, not by 6.
Yeah, Success Beyond 6.
Beyond 6.
Is with the mental health
That's the
agency.
one, okay.
Success by 6, it started out initially under Governor Dean, where every child, they left the hospital with a basket of books, and the nurse would be following up a few weeks later, et cetera. Do we do things like that anymore?
That's part of what parent-child centers do. So parent-child centers do offer sort of welcome baby bags, and they're, take under their wing to try to make sure that they know who all of the new babies are in their communities and begin to offer them and reach out to those families and make sure they're aware of what the supports are. And then we also, there also is Children Integrated Services is trying to do that as well. And there's a lot of referrals from community agencies as well for those families that need extra support.
One of our representatives a couple of weeks ago during a debate said the most important characteristics will determine whether a child's successful in school is the mom's educational and the income in the family. Have you heard that one?
I mean, I'm not surprised to hear that.
Yeah.
I mean, it's not that's not something that's not the intervention point that we use, so I don't spend a lot of time thinking about that one.
Yeah.
Yes.
Thank you.
So.
Did anybody else? I think we can, Wayne, go ahead.
You brought up my original question. We'll go to that one first. My original question is, how many kids in a given year, what do you expect the total number of children are that are using this money?
Which
Rough-
money?
rough-
Oh, okay.
No,
The whole
the
thing?
whole pot,
How many kids are served?
just roughly,
Well,
just a guess.
All of them?
there's like 34,000 licensed childcare spaces. If that's sort of a
34,000 spaces. Oh, okay.
And there's a waiting list for many of them.
right.
So that's not just the number.
Yes, and that includes right. But so that's the question, right? Are we serving them or not? Right? If there's a waiting list. But then, and some of those, and the trick is it's always tricky for DCF to get these numbers because of the way that because there's overlap, right? You can be enrolled in childcare and doing children integrated services. You can. So I feel like the upper limit is closer to that 35,000 probably that we're touching.
And that's covering both pre-K and students that are in elementary school.
Yeah, so that would include anybody who's participating in a regulated childcare program, which again can include early childhood, those 0 to 5. It includes pre-K students, and it includes those that are enrolled in a regulated after-school program as well. Those are school agers that we.
So first graders or second graders who have if they participate in after school?
If they have a regulated if it's an after-school program that's regulated by the Child Development Division. So
As opposed to like
21.
elementary school has an after school program that they run, then you don't.
It depends. This is one of those things that's it's a little tricky, but for the 20, like if it's a 21, the 21st century after school programs, those are exempt from being licensed by childcare. And so, but no, if a public school is just running an after school program and they don't meet any of the exemption criteria, no, they would still need to be licensed by us. And then the reason people do want to be licensed by us is because then you have access to childcare subsidy. And that is the sustainable source of funding for the children in your program.
So just to explain what might be wrong with me, so I was born at home. My mother had a 9th grade education, and I learned my ABCs on the blackboard first grade.
And there's exceptions to every rule. John?
So you have 34,000 spaces here, and that doesn't include after-school things going on here. So what's the demand? You talk to parents and they can't get into
Yeah.
childcare because it's full.
Yeah.
So what's the demand in terms of, looking at that gap and where we think we want to get to?
Yeah. So I will say, so we,
Money?
yeah. So I will say, so we'll have a much better answer for you
Sure.
by next December. We have just engaged with a contractor that's going to help us do some supply and demand analysis. But I'm sure what I'm going to say is probably in line with what you hear from from families, right? Which is that's really hard to find infant toddler space. Most people can find a pre-K space, a preschool space. And then after school really varies by community. It's the challenge.
Lynn?
Yeah, thank you. Those 34,000, 35,000 that you're talking about, that's childcare, plus some other programs that you put in. What is the relationship with what you're doing with CPDF or all of these programs? And the special education, like I said, the early essential education, which has been around a long time.
Yeah.
Compensatory special ed, Title I, all all that. You're not involved with that, or you are involved with that? Would you count those students in your group, in your work?
Okay, so
Do you refer to them? That's another.
yeah. So, right, so that, I think, if I'm understanding correctly, the early childhood special education, early or essential, like the AAA, right, like, is largely funded through IDEA Part B, Section 519. So it's the same program as Children's Integrated Services. So for our Children's Integrated Services, those 0 to 3 kids, or 0 to 2 kids really, because at their 3rd birthday, we are the team of people that do that work, not me, right, that are doing warm handoffs, right, for all of those children, right, from Part C to Part B. And they, in that moment there, it's the school district who is responsible, that takes over. Yeah, so the school districts are really responsible for that. And then relative to, and that really is agency of education, then that's supervising and monitoring the special education services. Which is, again, it's aligned with universal curriculum, but it's not necessarily administered in the same way.
Right, okay. So it is, so, and you probably have references that you refer families to the IDEA.
Yeah, they're required. I mean, it's part of that. Yes, there's lots of requirements in terms of the outreach that needs to be done to try to find the children that need these services, right? Both younger children as well as and especially once they're into that school system and sort of the child find services to make sure that they're identifying kids as early as possible and they need supports. But that really is the agency of education in the school districts that manage that for the older children.
So you're not familiar with Success by 6, but my memory serves me correctly. The elementary schools got money for Success by 6.
I think there's Success Beyond 6 because elementary school starts at 6. So they're going home from the hospital with their basket of books, which is by 6 as by 6. And then there's Success Beyond 6, which is, I don't know if AHS is involved with it at all.
Beyond 6?
Yeah, Beyond 6.
Primarily through Department of Mental Health.
Yeah.
So
It
AHS
is a
is
huge grant.
many millions, yeah,
Yes, like tens of millions or
tens of millions.
more than tens of
Big,
millions.
yeah.
Yeah, and I think
Actually, so I suspect I remember Success by 6 being the schools before there was the Success Beyond 6. And then
yeah,
it was-
probably is true. Yeah. Yeah, no, and I think that that's some of the work, and I've been in Vermont doing early childhood related work for about 10 years right now. So that's my limit. But obviously there's people I work with who've been around much longer than that, right? And when they talk about Success by 6, they often talk about some of that work sort of transitioning into building bright futures.
Yeah.
Right, and into the parent-child centers. But again, I'm not familiar with the details.
Okay, thank you.
Okay, so we have the other two big ones are Title IV-E and SSBG, and maybe they're better talked about from your part that explains things on the other.
Yeah, so 4B and 4E, right, those are child welfare related funding streams. And so so 4B and 4E. So 4B is for children who it's paying for childcare financial assistance for children whose sort of safety or welfare is at risk in some way. That could be, a child from a family that doesn't have a home, or it could be a child that has a really specific special healthcare need, or maybe the parent does, right? So there's some specific reason why, it's really important for that child to get into childcare financial assistance. They don't qualify in the typical ways. And then 4E is for those children that who are or have been connected to FSD protective services, right? So again, these are kids for whom we really want to make sure that they're in a really stable, that they have access to really stable early childhood education environment.
So if FSD protective services, does that mean that they are wards of the state?
Some of them are, some of them, have the, have been, but are now in a different custodial arrangement. Some of them are kids who've been adopted out of, I'm pretty sure I'm right about this, that it's some of them, it's also in their adoption agreements that they've been adopted from the state as well.
Going back to the piece before, usually childcare subsidy is just for working parents.
Right.
And for these other groups, parents might not be working, but we still want them to get childcare. It's a better
That's right.
thing for the
That's
child,
right.
Better for the child.
Better for the child.
Yes.
Yeah.
That's right. That's what these sort of the 4B and 40 funds kind of are for those.
Family services, some of them are just under the supervision of the state.
Yeah.
Not necessarily in custody.
Okay.
Yeah. Thank you for the right words.
Not the exact, right, yeah.
Me neither, I know.
Exact thing, okay. Okay.
Um,
So those, 4B is capped. And you get about 433,000. That's what you got this year, and hopefully next year
Yes.
for 4B.
Yeah, and for 4E, that's an entitlement, so we are able to draw in that revenue depending on how many youth we have that qualify.
And you haven't had any trouble drawing funds for these?
Before this quarter, no. Just that I don't know what the future holds, right? So it's really.
So when you said quarter, so through March, you've been able to draw?
Yes.
And how often do you draw down funds?
Well, it depends on the funding source, and AHS is the one that actually draws in the
Okay.
revenue. We just filed federal reports, so I would refer you to AHS's central office if you have questions.
Okay.
Draws.
So, I don't know, it's probably about a month ago that there's been a lot of changes at AHS. Have you noticed any difference in terms of response too early to tell, or, you know, being able to reach the people that you work with on these various programs?
You mean HHS?
Yeah.
I'm sorry, I thought I heard AHS. Have any changes there? HHS, yes, we have had slower communication. We've been, trying to figure out, who we're reaching out to if we have a question about a financial report that needs to be filed. It's just kind of a complex navigation of communication at the moment.
Whereas before we knew the person that we'd had a
Is that
relationship.
person there anymore?
Well, it depends on the funding source, right? So we have like some people who we still have that we can still go to.
Yeah.
And in other cases, no, we have been given an alias, which is an email
Oh, yes.
that we just have to email the alias and hope that somebody responds.
That's right, right. Nobody's taking personal responsibility for that.
Mhm.
Yeah. But-
Yeah, there was reported a month or so ago, maybe before that, even the AHS Boston office for regional center was being closed or rearranged, and I think we did have AHS, and they might have been through with that, and we talked about the fact that the regional centers are being consolidated and changed, and so that's part of the people have left, people might still be around, but they may be somewhere else. I mean, is that part of this whole?
Yeah, that's definitely a part of it. It's just really, they've consolidated our region with other regions. And in doing so, they've set up these like group emails that you're supposed to contact if you have questions. And some of the people that were in our region are now in this, consolidated regions, but it's unclear necessarily who is where at the moment, at least from our perspective.
Yeah.
Writing it blindly into an email, hoping to get something.
On the programmatic side, we did lose all of our contacts in the Office of Childcare and in the Office of Head Start. They're out of Region 1, right? Which is the Boston
They're all
office. Yeah. So we're just, and they were very helpful. They provided us with really excellent guidance. And really helped us know that, kept us on track. So it hasn't, so we haven't had to, but at the moment, the funds are still flowing. It's just.
But you can see where it could be heading if you don't.
Yeah, or if we don't have a chat, if we don't, when we have questions,
Right.
before we could get answers really quickly.
And then that SSBG, is that the Social Services Block Grant?
Yes.
You've heard about it. Rich, is this the same one, or it's sort of in a bunch of different places?
Is the same one. I will flag that the SSBG funding that we have in CDD is actually TANF transfer. So it's funding that is part of our TANF block grant that we transfer into SSBG, and then we utilize it to support households receiving childcare through CCFAP that are eligible.
Okay. Right, there's under.
But then we-
Federal poverty level.
Yeah, but then it then goes on the SSBG report. It's a kind of a weird
Bureaucratic thing.
that happens.
And just looking at that from. You have a specific amount budgeted for FY 26. Have you been awarded that? I'm looking on the first page of the 4.791.
Yeah, so we are able to transfer 10% of our TANF award
Okay,
to SSBG. So that represents 10% of the TANF award.
so does that mean you've gotten the TANF award for FY 26?
No, it just means that that's what we budgeted when we built the budget.
Okay.
I think I mean, some of these things, like for like the CCDF money, theoretically, we're in the first year of a 3-year plan with them, and it's an approved state plan, and you know, there's a process by which that usually every year they tell us here's officially the amount of money, and it goes up, you know, often goes up a little bit, or, you know, and so we are in that 3-year process. Whereas something like the preschool development grant money,
Right.
that was an application, is more of it.
On the application.
And their application is come out.
So you budgeted for almost $7 million that you might not get.
That, well.
The work is tied to the award funding, right? So,
Yeah.
to the extent that we don't.
No, this is the second half. This is the money that needs to be spent by December 30th of 2025. That's $7 million.
Well, you have SF 25, you have 6.969. And then in FY 26, you have 6.
Yeah, so we're in the final year of a 3-year award. So this is really just counting on that final.
Okay, so you,
But again, we're in this moment right now where you have to be able to use your funds from any carryover funds from year 1 and year 2, you have to officially get approval. There's an approval process for that. That typically would already be wrapped up. We are getting active communication from that office around what information is needed to get that wrapped up. But again, they just have, you know, like many fewer staff to do the same amount of work.
so this money needs to be spent by December of this year?
2026, December.
Okay.
30th.
Right.
Okay, so basically you have a year and a half.
25 this year.
Yeah.
6 months, 7 months, you're gonna have to spend that.
Need suggestions?
No, we don't need suggestions. We, no, I mean, we're working really hard.
So assuming you had that, but then in January, you would have possibly had nothing. And so then what happens?
Yeah, so that's, I mean, so the staff people that are hired against this right now are limited service staff. And so they, and so I think the question would be whether or not and again, it depends on how the whole spending picture comes together, right? If we would be able to continue them for a certain period, you know, for a certain way, be able to swap in a different funding source to support them, or, some of the positions, I mean, again, some of the positions may, if there's not the work to do, right? Some of the positions have to-
And if there isn't the work, so there's the positions, but then there's the kids or families or whoever gets impacted by you not having this.
Right.
And those are, hang on, I'm just trying to figure out who those.
This is the multi-agency grant, so it's very complicated. So some of it is training, it's training child mental health clinicians on parents as teachers as a very specific methodology that includes like two-way mirrors and observations. And like, it's a whole like real specific thing that, again, if you can train people on it and help them buy the equipment that they need for it, great, that can have benefits, right, going forward. And that gets built into part of the work that either is done through the designated agencies or, so that kind of, it's designed to do things that could actually achieve benefits beyond the life of the grant. There also was a portion for grant making out to community programs as well. So it, and again, it's designed to build some data capacity. And again, that the tools that have been built will continue. Some of that stuff can continue. So we would but that's where, at this moment, we're really focused on, well, we're focused on the carryover and that request first, and then, and then trying to understand how it fits into the picture, into the funding picture, big, to think about what happens in January.
So
Yeah.
Wayne and then Lynn.
And I would just add that, whenever we apply for these grants that are large dollar amounts over multiple years, but are not in perpetuity, we always try to find uses that are one-time in nature, but have long-term beneficial impacts. And so that's really why we focus, those funds on things that will build the systems that will then be able to continue after the fact.
Yes.
Wayne, Lynn, Joe.
So none of this is formula grants of any sort that you just automatically get based on some formula by state formula.
No, they are.
Some of them are that, yes.
Some of them do.
Yeah, I mean, you still have to fill in a plan, like, so, I mean, the Child Care Development Fund, right? They're telling us how much money, they're saying these are the standards you need to meet. So your plan is, this is our plan to meet the standards. And they say, okay, great, you've met the standards. This is how much money you, Vermont, get based on, well, not based on your plan, based on how many children there are in your state and how much money your state is putting in and some other variables that Megan might know.
I don't know them off the top of my
Okay.
head, but there are factors that determine it, and then we submit our.
We've heard from other places, we've heard testimony where, they come up with a plan, send in your plan, and if they accept it, it's essentially like a rubber stamp, and you get the money for that. This doesn't work that way. You've got some formula kinds of things in there.
Closer to that. I mean, I think IDEA is that the Individuals Disability Act, that is closer there. I think that in the past, the CCDF, the Community-Based Child Abuse Prevention grants have been that way. It's those pieces I think have been organized in that way. The places where it's things like PDG has been more of a competitive grant that we don't have a guarantee that we'll have it into perpetuity. Though what we've been hearing was that was the intention and that was the direction that office had been intending to go. Doesn't sound like that's the direction they're intending to go anymore. And then I think, especially for, global commitment is also a really important funding stream. And that is, and that does fund for us. I talked mostly about it, I think, related to children and good services, but it does also fund specialized childcare differential for those kids that are, again, need some extra support to be safely included in care. It pays for that extra, it supports childcare programs because they need to be coordinating with more people, right? If they're serving those children, right? They need to be working with a case manager and the parents, complex healthcare provider, some things that are more complex. It also funds a portion of the funds that we give to the Parent-Child Center Network. And it also funds some of the strengthening families work that we do in the state. So, what happens with Medicaid and global commitment is also really important to us.
Oh, yes. It's all intertwined.
Yeah, but it's not like
John.
Yeah, I just want to say, you talked about a supply and demand analysis that is going to be, sounds like it'd be really helpful to
Yes.
answer all these questions.
Mhm.
Is that coming from federal funds or how are you paying for that? And when does that start?
I actually think that we are paying for that officially we got some administrative dollars associated with Act 76, and I think it's coming out of so I think that's coming out of state funds specifically, but part of the reason that we are, maybe it's coming out of CCF. I don't know.
It's coming up with admin funds.
Okay, great. So it's coming out of the admin funds. It's not a whole huge, I mean, it's real money, but it's not a huge chunk of money. And it is, but that is actually tied to a new federal requirement from the Child Care Development Fund that is asking us to do a few different things. Right now we have waivers through August of 2026 for those pieces, but they're asking us to do some more focused grants or contracts supporting childcare for children with disabilities, children from underserved areas, and for infants and toddlers. So that's a thing that, and the way you're going to decide the way you need to help inform your plan is understanding supply and demand so that we can actually figure out how are we choosing which areas, which grants to give, where to focus those things. So that's coming. So that's part of why we're doing that, but that's a change that's coming up that we're going to have to figure out for next year. They also are another requirement is moving to paying in advance for childcare. So doing paying prospectively. So the team is working on that change right now. And then another big change out of the federal government that was passed, a year ago, was a requirement that families who are receiving support through the Child Care Development Fund don't pay more than 7% of their income for childcare.
That was a federal
And
requirement.
that's going to be a federal requirement. Again, this is CCDF is there to its rules are that it's there to support children that have 85 whose income is less than 85% of the state median income, which is about 300% of the federal poverty level in Vermont. And we do have some families that are receiving child care financial assistance that are in that eligibility category, right? That aren't paying anything. There's a whole bunch of families that are eligible for the full subsidy. But we do also have families between that are, between 200 and 300% who are paying more than 7% of their income right now. So we also in that contract, like there's supply and demand analysis, but there's also analysis looking at the structure of, the CCFAP tiers, what would it look like to create, how can we meet that 7% threshold, but also create like a coherent program that is understandable by everyone, that doesn't have big cliffs in it, and from our perspective, doesn't cost a ton more money.
We need to go to a meeting. Jim's going to take over and John is up next.
This is kind of, and I think you kind of answered
Okay.
just a few minutes ago here, but if for some reason, like for example, the $6.9 million
Mhm.
chunk for programs here, there's a beginning here, so kind of looking at needing to utilize that by the end of this
Mhm.
year, correct?
Yes.
And if for some reason you had some balance left, there would be, it's just done. You can't
Yeah.
carry anything forward. Is there any opportunity for that?
That's what we have. So that's part of why we had a bigger balance, is because in the past you kind of can, it's been much more automatic to carry things over to a year 4. But no, the guidance that we're getting from our federal program officer now is we have no indication to believe that you'll be able to carry funds over into future years. So if you want it, you can just spend it this year.
And that's the case for all of these different grants, or are some a little bit more flexible than that?
I think it
Or
depends
some maybe
on
like multi-year?
it depends on the award. Some of them, are entitlements. And so theoretically, with no changes, we would always be able to draw down the cost for like 40. But yeah, it really depends on the funding source. Like CCDF has multiple years of liquidation after, so you get like 2 years after the award for liquidating. So we have like multiple years of CCDF that we're administering at the same time and filing reports on simultaneously. But again, so it's really hard to know where they're going to go with any of these awards.
Let's hope they keep things as they are. Thank you.
Yes, Dave.
Just one, different topic. You may have already done this, Megan, but could you provide us with a TANF budget that shows where all the TANF funding goes?
Yes, I do believe we have, but I don't know if I've sent it to everyone. I think it just
Maybe Tiff.
you and Beth Bloomley maybe, but I can
Thank
send
you.
that again.
Appreciate that. Yep.
And we did hear that 51% of programs have 4 and 5 stars.
Geez, where'd you hear that from? I didn't. I don't believe anything.
That's my magic verse.
Somebody
right
listening.
here.
Well, that's great. Thank you.
Yes, anything else that you would like to add at this point?
Thanks for all the great questions.
We appreciate your time and overview of all the various smoking parts.
Thank you.
Thank you. Thanks for your work. Yeah. Maybe just a couple notes on. We have a couple bills on our agenda, starting at 9:30, H 248, related to supplemental child care grants and child care financial assistance program. we're gonna do a walkthrough with Katie, McLean, and a possible vote. And then obviously more federal funding, late morning with the humanities. We've already heard some information from them in terms of their grant situation. Afternoon, we are looking at S60, which is related to the Farm Security Special Fund. And this is kind of an emergency fund. And then H86, which is the chloride salt reduction program. And we might have a vote on that, depending on how it goes. So that's in the afternoon after the floor. So with that, I think we're